All right. Well, first, I'd like to introduce you to a couple of people today. Our host for today's webinar is Rory Walker, our Vice President of Business Development, and we thank Rory for making this event possible. And I also wanted to acknowledge two members of our client success team who have been integral in the William Osler journey, Cindy Williams and Tracy Dunn. And now our featured speakers for today, Trish Geerlinks, Associate Vice President, Practice and Academics at William Osler Health System. Welcome, Trish. And Salus Global Senior Vice President of Client Solutions, Lisa Young. And with that, I'll now turn it over to them to take us through our presentation. Thank you both very much.
Wonderful. Thanks, Heidi. So the focus of this presentation today is partnership. It's about visionary leadership work driving us towards impact and outcomes, what is possible when you combine them all together, and the journey that we took to get there. So I'm excited for Trish to share a little bit more about that journey.
Thank you so much, Lisa. I'm honored to be invited to participate in this webinar and to represent one of your clients as a success story. It is very much appreciated that we get to share this story together because it was absolutely a partnership. I am sharing my screen, so can you confirm that you can hear me and that you can see me moving the screen? Yes. Okay. Thank you so much. Okay. So yes, I am Trish Geerlinks, the Associate Vice President for Practice and Academics at William Osler Health System. The body of this work was done in a previous role of mine when I was the Director for Women's and Children's, and I was in that role for a number of years. And so the journey we are talking about today did take us a number of years. And so I'll talk a little bit about us as an organization. We are a multi-sited organization. In the Women's and Children's program, we touch 3 sites. We touch the 2 acute care sites, Brampton Civic Hospital and Etobicoke General Hospital. And in those 2 acute care sites, we have birthing units, L&D. We have mother and baby and postpartum units. We have NICUs in each, pediatrics in each, specialized outpatient clinics in each of our acute centers. And then our Peel Memorial Health Center ambulatory site has another bouquet of women's and children's clinics. The most important thing for you to note on this slide, we do a lot of work at Osler. We have over 7,000, close to 8,000 some years, babies born at our site. We have over 12,000 outpatient triage visits and another 21,000 or more outpatient ambulatory visits. But the most important circle on this slide that I want you to note is the over 800 staff obstetricians, pediatricians, family physicians, and midwives that went on this journey with us. So we took a whole cohort of team across this improvement journey that I'm really, really proud and excited to share with today. And it was begun when we had a signal in our claims data. So in 17 and 18, when we were trending our data, we saw a signal that we needed to be responsive to. And as part of our regular integrated internal processes, the signal was a spike in our maternal newborn program in the number of our claims. So back in 2018, we rejoined with moreOB program. We had been a long-standing customer back in 2004 when the original version of the core team, I was actually a core team member back in 2004 when I was in obstetrics from the clinical perspective. We've had a few iterations over time, and back in 2018, we did join with our colleagues again. We built our core team. We planned our workshops. We had planned our material. We had written our material and were ready to be launched in March of 2020, when suddenly everything came to a halt. And like the rest of you, we had to do things very differently in a hurry. We had to address immediately our HHR challenges associated with the necessarily prolonged exposures for self-isolation, We hadn't been able to do congregate setting gathering. Everything changed. The world stopped, healthcare revolutionized, and we took a significant pause. We couldn't gather anymore for workshops. We didn't have a mechanism for continuing the way we were doing our moreOB previously, couldn't protect time for chapters and so forth. We were in survival mode. But this is where it got very pivotal for us to shift our thinking. We didn't stop our work with our Salus Global partners and our moreOB journey. The pandemic elevated our awareness and highlighted opportunities for clinical enhancement in a different way. And we recognized that we needed to evolve and transform with a focus on culture and interactions. And so that became the body of our work. Much of our work is associated with the what we do in our daily clinical work, and moreOB's best practices and alignment with SOGC guidelines, etc., allows us to do the best of our what to do, and the culture of safety speaks on the how we do our work, and the how in particular is how we work together as teams and partners. And this became more pivotal than ever in the middle of a pandemic. The why, of course, remained the same: to improve outcomes, to enhance patient safety, and to improve staff and physician engagement. We know that a culture of safety is reflected in the behavior of healthcare teams, which has shaped our beliefs and our values. And building a culture of safety, where safety is incorporated into the fabric of all of our work, is just as important as the what we must do in terms of meeting our standards of excellence. Research does show that an enhanced patient safety and improved outcomes are positively correlated with healthy work environments and healthy functioning teams. That's where we put our emphasis, because workplaces with a strong culture of respect and cooperation are more successful in providing high quality care within those high functioning teams. And so that was really the core for our work. And the re-envisioning and the redesign with our moreOB colleagues was very pivotal in our successes. So we did empower through the 4 Ps. We had a psychological safety approach that we applied as the 5th P. The guiding principles for our success was to stay true to the science of our work. So stay true to the clinical science, to the behavioral science, and the psychological just culture science, the patient safety science. Clinical science is utilizing all of the best practices inventory that moreOB provides to the clients, to us as clients. Behavioral science includes applying a psychological safety approach in every interaction of communication and teamwork to support behavioral change. And the patient safety science, of course, includes everything associated with just culture and quality of care. And so as partners, Osler and moreOB had those common goals for staying true to all of those sciences. Infusing through all of that work was the emotional intelligence and psychological safety, which we chased relentlessly. That is the core of all aspects of culture and interactions. And if you think about your own workplaces, you do focus on meeting quality of standards and standards of excellence. But how you do this as a healthy functioning team is significant, and it becomes a pivotal part of how you approach your work. Bringing interprofessional teams together through the pandemic. So our relationship with our moreOB colleagues became revised, re-envisioned, reimagined, and we did that with intention and with purpose in the middle of a pandemic. And what held that together was leadership. Leadership is, you must be visible and present, and is the currency. Visibility is the currency of leadership. And we couldn't have done this without our moreOB colleagues to help hold our hand through that journey. Healthcare is relational work. It is people taking care of people. And our job as leaders is to invest in the people who take care of people. And walking alongside people with this journey was extremely important. I'll talk about the 4 Ps in this way. So the participate, we knew that we needed to re-engage our teams who were set and excited to do our moreOB journey until we had to do things differently. So reinvigorating how we had participation, holding a team together that had been struggling for a number of years. This was really, really important for us and how we re-engaged them to participate in moreOB again in a different way. We made a plan, and the plan included how we were going to improve our culture and interactions, and that led us to our pledge. And the pledge I'm going to talk about particularly is our respectful workplace pledge. The practice is, how we were going to move through this pledge and implement it, and hold each other accountable with that psychological safety, which can be identified as the 5th P, actually. And that included how we spoke to each other in the work environment, how we spoke to each other in business meetings, how we did our work together as a team, how we approached, quality and safety from a failure to rescue model. And that was an essential theme in all of that work in the psychological safety. So I'll talk through each of those independently. So participate. I spoke about participation. This was ensuring that we had as many voices as possible. So when you're going to approach a new way of doing things, you want to have as much infusion from the field. As many people who work as closest to the point of patients and its point of care need to be involved in this process. And so we wanted to make sure that we had every voice represented possible, so that a pledge could resonate with everyone. You can put principles of honor on a wall. You can put a code of conduct in a policy. You can put a practice expectations, behavioral expectations, in a strategic and a corporate plan. But if it doesn't resonate with people, it will not be lived. And so it was really important for us to make sure that we engaged as many stakeholders as possible. So this allowed us to bring some rich insights into how we would design what a pledge could look like. And people needed to attach themselves to it emotionally. So one of the ways that we did that, the way we approached it, was we had a combination of uni-professional focus groups. So by that, I mean the midwives had a separate forum focus group, the obstetricians, pediatricians, family physicians. And we felt as though that was going to be very psychologically safe for them to be able to communicate openly and share their insights thoughtfully when they're in an environment that is just among their own, and they would be able to be represented. We brought everybody back together when we did our thematic analysis, but in the initial data gathering phase, we felt it was really important for people to feel comfortable with their own group. So that's why we approached it from a uni-professional focus group. We did also use virtual platforms. We used Mentimeter to gather people anonymously if they wanted to submit what a pledge could look like for them. We needed to make sure that we had the right people, and we followed the right process, and we took our time. So we didn't rush this. This was an 18-month journey, and it was in the middle of a pandemic. So we really had to handhold and coach this very, very gently and supportively. So we took our time. We didn't rush it. And I think that was very, very important and successful. One of the ways that we did our data collection was, besides the uni-professional groups, was we had giant street wallpaper. And these were massive wall posters. They were IPAC friendly, of course, and wipeable, but we had staff and physicians and teams write in the field what respect looked like, felt like, and sounded like. And this is in patient-facing environments. So this wasn't hiding in a lounge or in a team room. This was along a wall that a patient walks into as they're being admitted. This was extremely important for us for 2 reasons. One, it does hold people accountable to the way that they express their opinions and their perspectives. We wanted to make sure that people were very respectful. That's part of creating a respectful workplace pledge. But also, it was very important for us to have this in patient-facing spaces, because then patients see, wow, not only am I going to be cared for in a safe environment, but I'm going to be cared for by people who care about each other. So they don't just care about me, they care about each other. And it was very encouraging. And we did have families and patients stop and ask questions about the wallpaper. We also did huddles in patient-facing spaces talking about the respectful workplace pledge and gathering information. So we were very transparent, very open, and it yielded some amazing results. It was really about shifting our mindset, not only on how we talk to each other, and how we treat each other and how we work well together, but how we talk about how we talk to each other and how we talk about how we treat each other. It was it was a journey, and it was the right thing. I think it was the right mechanism for us at the time, and set the stage for not only how we cultivate a pledge, but how we're going to envision and live it. Because that's actually what's the most important part, is living a pledge. So on this slide, you'll see we took our time with our data intake. We took our time with our data analysis, funneling some through a thematic analysis process, what some of the major themes were. Then in fall of 2022, like perhaps many of you, we paused for yet another wave of this pandemic. This one, the pediatric wave that many of you may have wrestled through as well. And so that became the next layer of our pandemic work. So we took a pause, but then picked it back up again, where we presented our themes, went back to the same groups, went back to the same teams and professional groups to say, this is what we heard. Does this theme make sense? And does this sound and resonate with what you said and what you told us? And interestingly, when we did our thematic analysis, all the messages were, even though they were in different words, they were similar themes. And it is about attaching to that emotional side of you, that psychologically safety, need that we have to feel secure and safe in our environment. And every theme from every group in every program at each of our sites resonated in a similar way, which was very, very powerful. That I think was really truly the message that we needed to accomplish, was that we took people on a journey together. I'm going to share with you what our pledge looks like. We did, I've spoken about how it was represented and how we made sure we had all our voices. It was very visible, was very present in our work environment for a good long period of time, and it was validated repeatedly. And we needed to be able to resonate back in the validation process. Not only that did this resonate, but how we're going to hold each other accountable to embody the pledge, and building statements that are reflective with that, not only what they said, but how they would live it. Our final output. So this was the output. This was the Women's and Children's Respectful Workplace Pledge. Hundreds of voices of data sources, thematic analysis, filtered into the top 10 most common and validated statements in all the areas of emotional intelligence and psychological safety. I'll read them. I think we have the time, so I'll read them because they're powerful statements. As a member of the Women's and Children's Healthcare team, I commit to ways in which respect looks, sounds, and feels like this. Kindness in communication always. Listening to understand. Saying please and thank you. Addressing people by their name. Working in an inclusive team. Treating others equally and equitably. Feeling safe to voice concerns and opinions without intimidation. Acknowledging each other's presence. Valuing expertise and mentoring calmly. empowering and encouraging each other to do and be our best. Every one of those 10 statements was represented in 800 voices. I mean, as many voices as that we could get out, hundreds of voices to be sure. Many, many themes boiled down into these top 10 statements, validated repeatedly. Every one of those statements are in the area of emotional intelligence, psychological safety. That's what is meaningful to us. We want to work with people we feel safe with. We want to work in an environment that we feel good about. And we want to work together as healthy functioning teams. And this pledge came out of this exercise over a long period of time in which everyone agreed that this is what our commitment is to each other. So that's our pledge. We knew that we were going to have a shared, at the end of this exercise, we were going to have a shared product that everyone acknowledged we needed. And the piece of opportunity for us was in the accountability piece. Accountability is a vulnerable process. Me holding myself accountable is one thing. Holding someone else accountable who's working alongside you takes trust. It takes courage. It takes confidence. And those things can't be written in a policy. They're earned. You can't say, you can't mandate it. I'm your leader, you need to trust me. And then you need to trust each other. It doesn't work like that. It's cultivated over time. And it does take that leadership from the top to embody and to model what that trust and safety looks like. And so my colleagues, my physician colleagues, my chief of obstetrics and chief of pediatrics walked alongside during that journey with me from a leadership perspective and modeled and embodied that excellence. And it was really important as the leadership dyad and leadership triad that we stuck to that plan of holding each other accountable. It is a vulnerable process that also takes time. And so this is another way in which we were partnered with our moreOB Salus Global colleagues. And I do thank you so much, Heidi, for introducing, and Lisa, for introducing Tracy and Cindy. Sorry for that. Sorry, Tracy and Cindy. You were a significant part of our journey and you walked every step of that with us. And I thank you for that because we couldn't have done that without each other. And the next layer of that support came with helping our leadership live the pledge. And so we leveraged our partnership once again with our moreOB consultants who supported us in developing a series of workshops. And I would love to hand it over to Lisa to talk about that supported learning.
Absolutely. Thanks, Trish. Yeah, so as we thought about then, how do we continue to support, again, the shift that needed to happen, the mindset changes, all of the language that needed to be part of that pledge and reinforced day to day in that accountability piece. And just again, supporting and connecting with each other to do that. That's where that learning and development approach came. And with that, really the focus was on three main buckets or three main areas. The first was around mindset. And it was this idea around how do we hold up the mirror and essentially look at ourselves and understand where are our own biases holding us back? How do we manage all of that self-talk going on in our head so that we are better enabled to perspective take those around us, be able to walk in their shoes, be able to understand what motivates and drives people's behaviors, rather making assumptions and judgments about it. With that, we also focused on the skills and some of the skills that we required to do that. And again, these sound so simple, but they're things that we completely lose sight of in the day-to-day. It's those simple things that we minimize and say, yeah, we do that. No problem. I've got that. And we actually have to turn up the volume on those and attend to them and focus on them more. So skills like question asking, engaging with empathy with the types of questions we ask and how we ask them, and not ask them just for the sake of asking them, and not asking them just for information, but to perspective take, to get underneath and really understand why someone has a certain beliefs or certain opinions or certain directions that they want to take. And then obviously listening too. Again, listening to understand and get that perspective versus just listening for information so I can play that back to you the way I need you to hear it. So again, skills that we actually then use to elevate our curiosity and how we think about how we seek out information versus how we wait for it to come to us. So that passiveness versus that activeness. And then that last bucket was around the actions that we could take. And really focusing on this idea of, every interaction we have, every conversation we have, there are moments where we give and receive feedback. And, we focus on a lot, and when it comes to workshops and development on how to give feedback, we very rarely focus on how to receive feedback. And that's one of the biggest barriers as we look to how we engage, how we hold ourselves accountable, how we build trust. It's that two-way approach to how we engage in feedback and dialogue and improvement as a collective. So we really focus on that in that third bucket of focus. And then taking those three areas, we then move them to, okay, the who and the how. So the first focus was on that leadership piece. As Trish mentioned, leadership had to be front and center, walking the walk, talking the talk. And so with that, we took those three areas and we rolled those out in sessions that happened multiple times that were delayed. So it gave people time to put the application into practice, and were rolled out, like I said, over the course of the time, which you can see. So May, June, and September. And again, that focus was on all of those areas, but giving people that space, that opportunity to share their own insights. Because as much as we could didactically push that information, it's really important that people be able to talk through what it means for them personally. How are they going to anchor themselves in this? What are the ways that we are going to load their lips with some of the things that they can use to support themselves as they make these things habits? Because that's the ultimate goal, so that this becomes part of people's DNA. It becomes part of what they do day to day, but we have to kind of give them connectors and plugs to help get them there. So we really focused on that leadership piece. And then again, this team-based approach that we use with moreOB, we took it down to the next level, and Tracy Dunn, pivotal and played a huge role and was really the driver and individual who took that to and supported individuals roll that out at the patient-facing level. So with that, accountability is such a vulnerable process. And the clinical leadership had identified that, all women's and children's services staff really needed to go through some of these concepts in the workshops. They really needed, again, that insight, that knowledge, that support, that learning and development around supportive and collaborative conversations. And so with Tracy's support, all employees were exposed to those moreOB concepts and the content of giving and receiving feedback and of the other pieces, really on bias and perspective taking and some of those nuances that would really help with the day-to-day. And that was all part of the spring study days that were run by Women's and Children's Services. So a massive initiative undertaken by Women's and Children's Services. And we were able to infuse that moreOB piece into that. And then again, it's not enough just to do that. It's what do things look like after that? So what does the sustainment look like? What does that ongoing support? So the good news is, as part of that approach, it's continued coaching and continued support, both from a peer and manager perspective, to keep all of this alive.
Thank you, Lisa. All right, so the impact, and I have when we send this message out, if we're sending out the slide deck, I'll send you an alternative impact on outcomes slide that's a little bit more fulsome, because this just focused on the claims. But we did see an improvement on impact on outcomes. When you have a healthy working environment and high-performing teams, and healthy team dynamics, which is really the crux. The healthy team dynamics is the crux of this work. Well, then you are ripe for impact on outcomes and improvements. And we did see many improvements and positive outcomes. I'll highlight the top 5. We saw an increase in our physician and staff engagement scores. when we began this journey, we looked at that as one of our data sets as an opportunity to work on our culture and interactions. And we watched them throughout the pandemic. And interestingly, we did see them increase, the scores increase in the pandemic, not decrease. But we saw overall at the end of this body of work an improvement in our physician and engagement scores. We saw an improvement in our HR data. So we did see a decrease in nursing sick time, and a decrease in our vacancy rate, and an increase in our retention rate, and a decrease in our overtime. So if you just think about that, if you just think about the HR analytics there, if you are less likely to come to work in a place where you feel burnt out, or you feel burdened, exhausted at the end of a shift, and those shifts happen, then we saw lots of that in the pandemic. That's part of the clinical work. But if you also have that shift and you've had a really difficult time working with your team, you're less likely to enjoy what you do and want to come back. And so just paying attention in that healthy team functioning goes a long way in improving those HR data of decreased sick time and increased retention rate and a decrease in vacancy. And anybody who survived the pandemic knows that all of those data were impacted anyway through the pandemic. But we were able to improve that even more through this Respectful Workplace Pledge. We saw an increased patient outcomes, an increase in improvement in patient outcomes in the form of a reduction of the number and severity of harmful events. We did see, and there's correlation data to support that when you have higher team satisfaction, you have higher patient safety and decrease patient safety incidents. And so we definitely saw that. Our patient experience metrics, all of our patient experience metrics were well above the corporate target for 24 months standing. And again, when you have healthy team members working together collaboratively and have healthy work environment, you are going to have, and you're going to impact positive patient experiences. So those patient experience metrics all increased as well. And then we did see a decrease in our claims, which was one of the triggers for doing this work. Was we were starting to see a spike, and we wanted to be responsive as every organization does. And we saw a decrease in our claims by 80%. That isn't the only outcome that was associated with this particular work, which is why I didn't want to leave this the focus. While we did see an improvement in our claims data, we saw many improvements over time. And so those top 5 that I've just spoken about, it takes intention, it takes tenacity, it takes perseverance. It's hard work. It can be viewed as soft skills, but there's no such thing as a soft skill when it comes to psychological safety and behavioral science. It's hard work. And this leadership team stuck to that perseverance and modeled through a very difficult time in our healthcare journey together, pre-pandemic, through a pandemic, and recovery of a pandemic. And yet this was one of the key pieces that we stuck to so that we could hold each other accountable and improve our work. Guiding principles for success. Sometimes you do need to reset the compass. You do need to reimagine your work, and that's exactly what we did once we were coming out of the initial crisis of wave 1. You do sometimes need to reverse engineer your journey, where yes, our focus was on chapters and core team workshops, and in this time. At that time, we definitely needed to reverse engineer our journey so that we could find our North Star. And it is a long-standing, an old statement that soft skills eat hard skills for lunch. This is hard work. it's probably the hardest work I've ever done, because you infuse this accountability in everything you do. It shows up in every conversation, whether it's a hallway conversation, whether it's an S-bar between communication, transfer of accountability between colleagues, whether it is in a quality of care review where you're looking at systems focused and moving away from blame, that whole just culture piece, where you're no longer doing the name, shame, blame game. It shows up there every day. It shows up in your business meetings. It shows up everywhere, and it's hard work, and it's worth it. The outcome for us is that we have been able to move over time, and it takes years to shift a culture. Believe me, there's still work to do, but investing in this was the work that we needed to do. And I'll just end with a summary statement that the effective and visionary partnership between Osler and Salus Global's moreOB program has significantly contributed to an improved culture of safety and has yielded positive results, impacting many outcomes that I've spoken of. Culture and interactions are the heart of our relational work in healthcare. The intentional, innovative, and invigorating collaboration in creating positive behavioral care cannot be underestimated or overstated. Thank you.
Thank you so much, Trish and Lisa. Very much appreciate the presentation. Just wanted to let you know the chat is open for questions. We have a couple of questions that have come through. We'll just give a minute for people to put any questions in the chat area, and then we'll open up a couple of questions for Trish and for Lisa. Just give that a couple of seconds. Okay, I'll start it going, and we'll accept additional questions as you have them, no worries. Trish, just thinking about a question came in. If a team is wanting to get started, is there any work that you would recommend is foundational to that, getting started with this, that you think needs to be a precedent to this kind of work? Is there anything you'd recommend teams sort of pay attention to before they engage in this type of work?
Thank you. I think it's a great question. So thank you for whoever asked the question. You know your teams. You know your teams best. You know what happens in the field. You know what your engagement scores look like. You know what your workforce is, the novice to expert workforce. You know the tenure of your colleagues. You know the journey they have been on. And if you don't, and that's new for you, and you're a new leader in that area, then that is going to be really, really important for you to understand is where you've been. Understand where the team has been. And in looking at where you're going and where you are, for moreOB, and we've been a longstanding client with Salus Global for moreOB, those interprofessional learnings were always built into their models. So their modules of teamwork and communication, they're always foundational in their chapters and in their work. So they've never been separated. They've always been together. How you do things is as important as what you do. So I would say, if you know your team, and if you don't know your team, find out where they've been. But if you know your team, then start engaging in the conversation with them. Bring them along with the journey. It's one thing to bring consultants in to an organization, but if the consultant work happens in the boardroom, or if the consultant work happens in the leadership forums and is removed and distant from the front line, then it's going to be really, really hard to impact change in the front line. So you've got to bring the leader's job is to bring those two forces together, because if you want something to change at the bedside, it has to get out of the boardroom.
Fantastic. Thank you so much, Trish. And I think this is sort of, I wouldn't call it a segue, but it's an adjacent question. When we think about the engagement and bringing people together, we often hear about hesitation from one profession or another, whether that be from the physician group or from a specialty group or from another adjacent department who needs to be part of it. Did you have any barriers to engagement and participation? And if so, how did you get buy-in? How did you change that?
It's a pithy question that I think if you look at Tuckman's norming, forming, storming, when you're forming a team, you go through a storming, like that's going to happen. So when you're trying to form an improvement opportunity that includes culture and interactions, especially, and behavioral, you're implementing that whole behavioral science and patient safety science into your clinical science work, you're going to have storming. So you're going to have to be okay with it. And I think that's where people get stuck. I think they get stuck in the storming phase where you have people who, oh, I've always done it this way, or there's that whole, and the verbiage that you hear in your own environment, and maybe even in your own experience when you were in a clinical role. It's really important to let that play out. It has to play out safely. Like you have to call out when things are completely unsafe, but you have to be okay with that storming phase and people getting uncomfortable, getting comfortable with being uncomfortable, because I don't think you will progress unless people feel their fears are addressed. Sometimes, they're not really interested in what you have to say until they're heard. They don't really care what you know until you know you care. So all of those types of approaches, you really allow some of that storming phase to happen, because it can become your barrier if all of a sudden it's shut down. You have to open that door to say, I hear you, I see you, I hear your struggle, I see your struggle, and it's important. It's important to me, it's important to everybody, and we're going to work through that. So you build some trust. I mean, you can't do this without trust, but you build some trust in allowing people to be heard, and that does require some difficult conversations at times. And you have to be okay with that.
Well, that's great advice. Thank you so much. Another question that, again, and Lisa, if there's something you think that there's value in adding, please don't hesitate to jump in. But when you think about the sustainability, you did mention it, and you did talk a little bit about it, but I see a question come in around anything that you think would be helpful for others to understand about sustainability. And again, the work continues. That was loud and clear, but are there any tips and pearls you can offer from a sustainment perspective that might be helpful to those listening in?
Thank you. Thank you for whoever asked the question. If you measure something, it can be improved. If you don't measure it, it's hard to sustain. So keeping an eye on your whatever metrics were your success factors, and for us, things like our incidents, like our patient safety incidents and outcomes, our HR analytics, our claims data, our patient and family, staff and physician engagement scores, our patient experience scores, whatever it is that were your success factors or could be your success factors, can you continue to watch as a sustainability? And where you see slips, you come back and you revisit. I think what holds you is that this becomes part of your scorecard, part of your operational reports, part of your huddle data, whatever it is that you're staying on top of and reinforce, because what you recognize, you reinforce. So keep reinforcing, just like any other metric, it's just as important. Culture and interactions is just as important as any other metric. And so I think that's how you maintain and sustain, is that you stay on top of it. And that requires intention as well.
And I was just going to add one point to that. I think the other thing is, and Trish, highlights it, that there were success factors and success criteria that were identified up front. And I think that's the biggest thing with measurement. If you start thinking about measurement after you've already started to implement, you're too late at that point, right? And I know it seems so obvious, but we do often forget about it. And with that, the only augmentation to that is to challenge ourselves to look at the things we're measuring and say, are we measuring the right things in the first place? We might say that we have all of these things we already measure, but don't use that necessarily as the benchmark to say, okay, so now we want to see an improvement. It's a great opportunity to sort of challenge yourself and say, are we even measuring the right things internally? Are there opportunities to augment, shift, change, or even add in temporary metrics that are going to help us? So just always kind of re-looking at how are we tracking our success holistically, and are there opportunities to continue to evolve and tweak that?
That's a great point, Lisa. And in fact, that segue from what you both just talked about, Trish and Lisa, is to a question on the measurement and the measures. And is there any secret sauce to ensuring that the right measures are set up in front? And the reason I say that is because, as we know, if you don't define them up front and you don't set that baseline, then when you get to your end state or your mid state or the point where you want to actually determine progress, you can't go backwards. Is there anything in the dialogues or the setup for this that helped you ensure the right measures? And again, I know for every organization that might be different, but is there anything you could share with the group that might be helpful for them on measures?
Thank you for the question. And I understand, I've just said, if you want to improve to impact on outcomes, you have to measure it. The engagement scores, they're not a sidebar. They're a part of I think the secret sauce. They're not the additive. If you've got it in the cupboard, add it. I cannot stress how important it is to understand that this is relational work. Healthcare is relational work. It is people focused. And so we tend to put a lot of emphasis on other things. And measurement for all kinds of clinical outcomes is important. Don't get me wrong. But we often say, oh, and our engagement scores are this. Work really, really hard on improving the engagement in your environment. Work really hard on supporting your team, the physicians, the midwives, the professional practice, allied health, nursing, work really hard on people. I think people measures are probably to me, they're the most important scores. Yes, we have lots of other scores that we have to be accountable to the board and for our scorecards and our strategic plans. People and culture is the center of all of that. You can't do anything without people. So putting a great deal of emphasis on those particular metrics, I think, is what were our success. Revisiting back with focus groups and huddles and like going back to understanding the nature of their work. That helps people feel engaged and heard and supported. And I just want to say, people engagement scores, physician and staff, are just as important as any other metric. There will always be projects to do, policies to write, practices to enhance, policies to follow, processes to improve, but you can't do any of those things without people. So people and culture has to be at the core of all of your measurement work.
Thank you so much, Trish. We only have a couple of minutes to go, so I thought it might be appropriate just to close with the following question. If you were to do this again, is there anything that you would do differently? And any final remarks other than that?
I hope it's okay that I stop sharing my screen. Okay, good. I would do it sooner. We did it out of necessity related to a pandemic, and many, many things were highlighted in a pandemic that we needed to do things differently. Meeting virtually in 2 dimensions is one of the things that has been, something that we've done out of a necessity, but I would have done this much sooner. A way in which we integrated our Salus Global colleagues, so Tracy and Cindy as our client success consultants, they actually joined one of our organizational development sessions. And so we had a corporate event, a corporate workshop around culture and interactions. And I invited Tracy and Cindy to sit at the table, and I had to explain it a little bit to our OB colleagues and say there are moreOB consultants, so that's why they're here at the table, and it wasn't challenged at all. It was wonderful, but I would have integrated that sooner, and I would encourage anyone who is sitting on the fence about joining, with Salus Global as consultants, or who's looking to reinvigorate that relationship. Maybe you were one of those people from 2004, and haven't reimagined what that could look like. That's what I would do. I would have done that sooner for sure, because this was, and it's always been there in the module, and in data teamwork and communication and all those other behavioral science pieces has always been part of our clinical science. I would have envisioned this sooner, I think.
Well, I think that's all the time that we have for today. I want to again thank Trish very, very much, and Lisa as well, for your participation, for your presentation, and for your thoughtful comments. I want to thank everyone who took the time out of their day to attend our webinar showcasing William Osler's health systems journey for a respectful workplace. We'll be in touch, and we hope we'll be able to have many more webinars in the future. Thank you so much for joining us today, and have a good afternoon.
Thank you.